A bigger problem for many, many people is tinnitus, ringing in the ears. 50 million people suffer from this problem. Sometimes it is so severe, it affects their ability to concentrate. Sometimes it even drives them to the edge of suicide. So we're going to learn a lot about this problem that really isn't ringing in the ears at all. It's really kind of a ringing in your brain. And the two experts we brought to the table today are audiologists from the Hearing Center, a practice operated by ENT Associates. Let me introduce you to audiologists Allison Shorgen and Madison Zeigel. Good to have you back.
Yes, thank you for having us.
Thank you. Okay, did I get that right? Is this ringing in the ears or is it ringing in the brain?
Yeah, ringing in the brain does seem to be a little bit more of an accurate description. People perceive it in their ears, but really it doesn't have to be because of the ears. So
what's going on? What's happening that causes my brain to hear that awful sound?
It seems to be most commonly perceived when there is a lack of other stimulus, typically from the ear. The brain's filling in the blanks. It says something's missing. I have a solution. Not something people want to listen to, but what they get.
Yeah. And we're calling it ringing, but Allison, you told me that people hear lots of different things that that is tinnitus.
Yes. So when patients come in and they're describing the sounds that they're hearing, they can use lots of different terms. They can describe it as ringing. They'll describe it as hissing, buzzing, roaring, humming. Some people even perceive musical tunes. It's not as common, but it does happen. And so we have to be careful about saying, hey, do you have ringing in the ears? Because they may tell us no, but they may have other noises that they're hearing. Can you imagine hearing the Village People on a loop in your head the whole day? 25, that'd be terrible. I don't know. Sometimes that might be peaceful.
That's funny. How bad has this problem been? And what have people told you about how they experience it?
I think it varies from person to person. I have a lot of patients who come in who report, yes, I have ringing. I notice it, it's bothersome, but I can deal with it. I use coping strategies and it doesn't bother me for the most part on a day-to-day basis. We have other patients who come in who are really disturbed and bothered by it to the point where it affects their everyday life. It affects them physically. They have an increase in anxiety and depression to the point where they don't want to deal with it anymore and they start thinking about suicide.
Yeah, that's awful. And so what can we do for these folks? If we don't know what really is the cause, I mean, there's nothing necessarily wrong with your ear, is there?
There could be. There could be damage in the ear that's sending kind of misfires to the brain, and that could be a cause of it. There could be increased stress, increased anxiety, depression, and it's more of a neurological problem. So there are so many different causes. And really, to know if the ear is involved in it, a hearing evaluation would be the most effective kind of evaluation process.
Yeah, because often the tinnitus goes with hearing loss. Correct?
That is correct. So the stat is 80% of people who have tinnitus also have hearing loss. Oftentimes those patients are the ones that are telling us, I don't have any trouble hearing, I just can't hear because of the tinnitus. So it's kind of like the chicken and the egg. Which one comes first? Mm-hmm. Is it that they have the ringing and that's what's causing them to not hear as well? Or is it that they had the hearing loss and then from the hearing loss comes the tinnitus? That's the million-dollar question.
Yeah, I mentioned with Rob in Midwest Ag Matters just a moment ago that this is a problem with not only the producers, farm families, but other folks who work in noisy environments tend to be. So does that match with what you're seeing in the clinic?
Yeah, absolutely. Loud noise exposure can certainly increase the chances that somebody is going to experience tinnitus.
And oftentimes, people will say, I went to this loud concert tonight or last night, my ears are ringing like crazy. They're really loud. So certainly there seems to be that correlation with when they're exposed to that loud noise. It's almost like a healing mechanism for the ear, it really is a warning trigger of, hey, you're damaging your ear. You need to back off.
Yeah. Yeah, I think we've all experienced that, loud kind of exposure, and then it sort of goes away. But when it doesn't, when you're laying there in bed at night and you're trying to get to sleep and your ears are just ringing, it's funny that sometimes it kind of comes and goes. I'll have that problem some nights, and other nights it's not an issue at all. What can you do about that? So that's the big question, right? How do we fix this? Mm-hmm. Is there a cure?
There is not a cure. It's a frustration for a lot of people, but there is not a cure. I usually tell people, if you notice it at night, sleep with a fan, turn a sound machine on, something, again, to provide a little bit of distraction. I do that myself. I have normal hearing. Some nights it's worse than others that I notice the tinnitus, and I've always slept with a fan just to, again, not have that to focus on. When I'm traveling and I forget to bring my fan, I have an app on my phone that is a fan sound. My brain is used to that, and it feels more at ease. But yeah, some nights can be worse than others. If I didn't sleep well the night before, it seems to be, worse the next night.
Yeah, well, that makes sense, I guess. As you said, a neurological issue, so anything that's going to stress your neurological system could enhance that. What role do hearing aids play in dealing with tinnitus?
I think it plays an important role, a twofold role, really. One of the things is, again, 80% of people who have tinnitus also have hearing loss. So those patients really tend to benefit from wearing hearing devices. A, they're going to hear better, but B, they do notice a relief from their tinnitus because, again, it's providing that stimulation. They're now hearing things they were missing, and so the brain isn't feeling like it needs to kind of fill in the gaps. So many of my patients who come in who say, I have this ringing, they do get relief. Now, it's important to note that not everybody will get relief from their tinnitus with wearing hearing devices. There are some patients even who have hearing loss with wearing hearing aids. It doesn't make any difference. But I think the secondary thing is in many of the hearing devices today, there are tinnitus maskers in them. And those tinnitus maskers can be used to, again, provide that stimulation so that they can forget about that tinnitus, because one of the things that exacerbates it is that stress of, what is this? Why do I have it? And the more you focus on it, the more you think about it, the worse it gets.
Tell me more about these maskers. How do they work?
Yeah, they are a sound generated by the hearing device to, again, similar to my fan at night. Some of it's a white noise sound. Sometimes people prefer more of like a thunderstorm, waterfall, music that they enjoy listening to, something to kind of be more of a stress release so they don't feel like all I have to listen to is this tinnitus, and again, create kind of that vicious cycle, just accelerating it.
So I can choose what I want that masker to be? Is it operated by a smartphone or something?
It can be, yes. There are some that are kind of pre-programmed into some of the hearing devices that in the office while the patient's right in front of us, we kind of go through the different options and see which either provides the most relief or is just a preferred listening sound for them. But yeah, their app that are, on the phones or just streaming different sounds can also be an option they can change daily if the sound they're hearing changes over time.
Welcome back to the program. We are talking about tinnitus and hearing loss this half hour, what you can do about it. What a big problem it is for so many people. And our guests this half hour are Allison Shorjan and Madison Zeigel, audiologists with the Hearing Center, a practice of Ear, Nose, and Throat Associates. So you guys have something that's pretty cool on your website. I did it the other day. It's a free online hearing test. Walk me through this. Tell me how this works.
Yeah, so the online hearing screener is really, I would describe it as a two-part tool. The first part is you actually plug in headphones or earbuds and you listen to some different tones, low tones, mid tones, high tones, and you adjust to where you can hear that tone. So you walk through that part of it. The second part of it is really a series of questions. How do you hear when you get into noise? Do you feel like people are mumbling? And then the results of both how you heard those tones and how you answered those questions kind of gives you a score as to you're okay, your hearing's good, or you could use some further evaluation. So if you could use some further evaluation, the next step would be then to do a full complete hearing evaluation.
So you can find that at enthearingcenter.com. Again, that's enthearingcenter.com. So I found out that I could hear with the volume turned way down in your tool, except for one band, and I don't remember if that was mid, high, or low. I don't recall. But I was surprised how much I had to crank that one up. Yet at the end it said, "Hey, you're fine, don't worry." So that was kind of comforting. But if it's not, if it advises me to get an evaluation, walk me through that process. What happens? You know, I remember from being in school, you know, the whole hold your finger up, you can hear this thing. It's got more sophisticated than that, I'm sure, hasn't it?
Not really.
Really?
It's effective, so we don't really change it too much, but we do a little bit more of a diagnostic evaluation. So still have you hold your finger up, say yes, say beep. Let us know in some way when you are hearing the sounds. And we are looking for the lowest level that somebody's able to hear them. We also do a little bit further testing, put the headphones on, also put a piece behind somebody's ear and play those same sounds. We're looking to see, is this a permanent hearing loss? Is this something that we're expecting more of a nerve or, hair cell damage? Or is this something that if we, can relieve some fluid from their ears, they can find relief? We also say some words and look to see kind of how effectively people are able to repeat those back. So it's certainly more involved than your days back at school, but it's pretty similar.
We've heard, there's the joke about selective hearing loss, I can't hear my wife, but that's a legitimate thing, isn't it? That her voice might just be in that range where I can hear my buddy, but I can't hear her.
Correct. It definitely is a thing. Everybody's voice does fall into a different range, and so depending on where your hearing levels are, some people may be more challenging to hear than others. I think the other thing that contributes is that when somebody is talking, everybody talks at a little bit of a different volume. So especially if your hearing is just starting to not be as good, you may have more difficulties hearing somebody who is a little more soft-spoken versus somebody who has a very strong voice. And in general, I would say men tend to have a stronger, deeper, easier voice to hear for people than women, because women and children tend to be a little softer, a little more meek, and a little higher pitched. So people do tend to have more trouble hearing them as that hearing tends to decrease. But it really depends on where's your hearing changing.
Yeah. And I hope we've gone beyond, I know we haven't, but I would love to get to the point where wearing hearing aids is no longer a stigma. I mean, my gosh, I'm wearing glasses all the time. What's the difference? I don't really care. And the hearing aids that are coming out today, there's some fantastic technology. Tell me about the latest, greatest stuff you guys have at your fingertips.
Yeah, absolutely. Last time we were in a few months ago, we did talk about some technology, but really the biggest thing, especially for those that have tinnitus, is the Bluetooth capabilities that hearing aids have now. It gives them the ability to listen to different sounds, to receive phone calls right in their ears, to just find what they enjoy and kind of run with it. I've had patients that really weren't too concerned, don't get out of the house very often, have coped with their hearing loss per se. But they have tinnitus and they want something that's going to help them. They're busy, around the house, they're trying to clean. And so I have a patient who loves listening to her audiobooks. She puts the hearing aids on, she, gets her favorite story for the day, she wanders around her house, and as long as she's within range of her Bluetooth, she feels like she's kind of gotten control of her life back. She's not so bothered, but she's able to find things she can enjoy again.
And Allison, you wear hearing aids, and are yours the Bluetooth model?
They are the Bluetooth model, and again, I think I talked last time about how rechargeable was a game changer for me. Bluetooth has been a game changer for me, and I really didn't think it would be. But being able to talk on the phone with ease, hearing the phone in both ears, makes it less stressful. I'm less anxious to be on the phone because it's a lot easier now with it going straight through the hearing aids. I think the other thing is being able to enjoy music. I can't wear earbuds. I can wear headphones. Doesn't sound very good, but listening to music through my hearing aids has been a game changer. Watching movies, the sound quality is amazing. It really has kind of changed. I feel like I'm more like people with normal hearing because I get to enjoy things that they do and I never did before.
Oh, so it's so you've got earbuds in all the time.
Essentially, yes.
And so nobody would know if you're rocking out, right?
Yes, and I think
she's been caught before at work.
That's funny. So if I'm concerned about cost, I would assume kind of get into a hearing aid without breaking the bank. I got to bring up the fact that once I started doing research on this, man, my Facebook feed got flooded with ads for hearing aids, and some of those things the price seemed ridiculously inexpensive. What am I going to get into if I go down that path?
Yeah, so I think that's always a patient's concern is cost. And I always tell patients, you get what you pay for. So if you want to go online and buy a $50 hearing aid, it's not really a hearing aid, it's an amplifier, then do so.
Now, wait a second, let's talk about that for a second. So all this doing is turning up the volume on everything. So that means if you have a hearing loss in one particular frequency, you're still going to have that hearing loss in that frequency. It's just that everything else is going to be blowing you away.
Absolutely, yes.
Okay, so that's an amplifier.
Correct.
But there are are the actual hearing aids that they're offering online?
There are some websites that do offer hearing aids online. Here's the caveat. It's illegal. It's not in the regulations. A hearing aid can only be dispensed by a licensed professional.
And why is that important?
It is important to be dispensed by a licensed professional because I think one of the biggest contributors to a patient's success is how well is the counseling that comes with being fit with hearing aids. It is a adjustment period, it is a process, and so that counseling that comes with it is important. The secondary thing is every hearing loss has a prescription of how much volume we want them to have for good audibility of speech. If you're not getting that prescription, if we're not getting audible speech, guess what? You're not going to understand speech well. The only way to know that you are getting good audibility of speech is by doing a test called real ear measurements. That can't happen online. Doesn't happen in most audiology or hearing aid practices. But it's really important to ensure that prescription is set for audible speech, because at the end of the day, if you're not hearing those speech sounds, you may hear it a little better, but you're not really getting the full benefit from the hearing aids.
You know what? We have to leave it there. The clock is calling our time done. But maybe next time around we can talk about if you're dissatisfied with the hearing aids you have, what options do you have and how can we make those better? Maybe that's a topic we'll hit some other time, okay?
Yeah, I think that sounds like a great idea.
That is Madison Zeigel and Allison Shorjan from the Hearing Center. You can find them online at enthearingcenter.com.